My name is Lauren, and I'm talking about staphylococcal infections. The verse that I chose to read is, "And the prayer offered in faith will make the sick person well. The Lord will raise them up. If they have sinned, they will be forgiven." So, signs and symptoms of a staphylococcal infection. One of the signs is having pyodermia, which is any pyogenic infection of the skin. Otis externa, which is an external inflammation of the ear. Infections at a surgical site. UTIs, which is a urinary tract infection. Osteomyelitis, which is an infection to the cortex and medullary cavity of the bone. And ocular surface infections, which is an infection to the eye. The causative agent of staphylococcus infections is a Staphylococcus bacteria. The most common type of this is Staphylococcus aureus. This can be seen as a coccus, which is a spherical shape in grape-like clusters. It is gram-positive, showing purple on a slide, and it reproduces by binary fission. They are often found on the skin or in the nose of people and cause no harm usually, but they can lead to food poisoning or a skin infection. If the infection gets into the bloodstream, joints, bones, or lungs or heart, it can be deadly. The pathogenesis. Often the bacteria colonizes in the skin and nasal mucosa, like the nose, throat, or GI tract. The colonization involves microbial surface components recognizing adhesive matrix molecules, clumping factor B, and wall tachyonic acids. When the skin barrier is broken, they stick to cells and then they spread throughout the body. The infection often follows inoculation into the wounds or after viral damage to mucosa. Once inside tissues, the bacteria release toxins and enzymes that damage the cells, helping them to spread and survive. Often the formation of a biofilm occurs, allowing persistence on medical devices and resistance of antibiotics. This makes the infection harder to fight. The epidemiology of staphylococcal infections. It has the geographic distribution is worldwide, causing both hospital and community-associated infections. There are different clones of Staphylococcus aureus in different parts of the world. In Africa, it can be seen that there's a big reservoir for damaged form of the bacteria because many strands have a strong toxin, PVL, that can be resistant to methicillin. In the Middle East, MRSA is spreading quickly. Some strands contain PVL, others don't. In community MRSA is very common in Asia. Some strands are resistant to vancomycin, others are not. Staphylococcal infections are evolving differently across regions, with new resistance and virulent strands appearing outside traditional healthcare settings, making it a global challenge. Prevention and treatment of the infection. A skin staphylococcal infection can be treated with a topical antibiotic and a prescribed oral antibiotic to treat the infection inside the body and on the skin. In severe cases, treatment may include an IV antibiotic to kill the bacteria. For protection of a staph infection of the skin, one should have good hygiene, keep their cuts clean, wash their hands and body often, and avoid sharing towels and personal items. For protection of food poisoning, one should practice good food safety. In avoiding toxic shock syndrome, one should change her tampon every 4 to 8 hours. Within a Christian worldview, these practices reflect the call to serve others by safeguarding their health and well-being to avoid the spread of infection. By taking steps to reduce transmission, individuals contribute to the protection of society's well-being and help the Christian principle of helping others. Infection control becomes both a medical responsibility and a moral service to other people. These are my references. Thank you.